Hello and welcome inside the training room. I am your host, Dr. Ken Kaufman, and I am absolutely pumped to have you here where you get exclusive, behind-the-scenes, VIP access into the training rooms of professional sports. In this episode of Inside the Training Room, the anti-Iceman, Gary Reinl, will reveal how he changed his entire treatment approach when dealing with sports injuries. He also discusses his book and how Dr. Gabe Merkin reverses his stance on his own R.I.C.E protocol.
Let's get something. Let's pull something straight off the top in the very beginning here. I wrote the book R.I.C.E, the illusionary treatment option. And that's 8 years ago. I took on the entire sports medicine complex. Very few people were on my side at first. There were some, but very few. And then the doctor who made up the R.I.C.E protocol, rest, ice, compression, elevation, the person who made that up, Dr. Gabe Merkin, after reading my book, publicly recanted, said, look, I made this up in my 1978 sports medicine book. Research has clearly shown I was wrong. Don't do it. It delays healing. And gives a specific reference to the fact that it causes additional damage. Now, that ought to stop my critics right in their tracks and say, no, wait a minute, what did he just say? I'm telling you, the guy who made it up read my book and publicly recanted, and then wrote the foreword to the second edition of my book. So I got the doctor, the Harvard-trained doctor, who made up the most recognized protocol in Western medicine, to publicly recant and write the foreword to the book that took down his protocol. Now, over 1 million people have heard my message. So here's the question I had to anybody who isn't agreeing with this right now. First of all, drop your guard and just listen, because I'm going to prove to you that it's true. But more importantly, stop for a second and just say, how could you get the doctor who made up the most recognized protocol in Western medicine to recant and write the foreword to the book that took down their protocol? Well, obviously, I proved it.
Right.
That's how I proved it. And it's when the literature.
That's right. And
you started reading everything. As soon as you start reading the literature, you're like, this isn't even a question. What's going on here?
Yeah, exactly. And that's the thing. In that, we did a webinar the other day, and somebody asked a question, and that question was, what do you say to a doctor or another trainer that says, hey, I've been treating injuries with ice for 30 years and it's been highly effective, blah, blah, blah. And my comment back to him was, well, the worst words in the language are because we've always done it that way. And, we used to ride horse and buggy too, but, they came out with a thing called a vehicle that could take us places. So, you're such a pioneer in that, and a trailblazer in the whole process. And it was simply, I think, because of your inquisitive nature and, kind of scientific mind of looking at things and not accepting the status quo and accepting things as they appear. So go on and talk about how, how you continue to refine your message, because I know that, when we spoke in Vegas, you had some new ways to term things, and to, when dealing with the doctors that really give you a lot of pushback, even now, after you give those, perfectly rational understandings. Go over that a little bit too, because that was fascinating.
Well, here's a big point about the comment that was made to you, that I've been doing for 30 years and it's always worked. No, in spite of you, it worked.
Right.
In other words, the human body is so well designed that even when you do the process wrong, now let's just take and say, why do they think it worked? Well, because the old person ultimately got better. And how long did it take? Well, it took 4 weeks. Okay, well, if you hadn't done that, how long would it have taken? Well, I don't know, because I've always done it. Okay, well, here goes our start. This is where we're going to start questioning things. Now, this is the big point. This is the turning spot for me and my understanding, and hopefully for your audience. You're asking the wrong question. When you say to me, I've got a person who is injured, or for that matter, they're just tired and sore from, say, throwing a baseball 100 times. But there is micro damage and
Mm-hmm.
there's damage. So you're injured, whether it's slight or significant, you are injured. So what are you trying to do? Are you trying to make tissue cold? Well, no. But what are you trying to do? Well, I'm trying to help it heal. Okay, so how would making it cold help it heal? By the way, you'll hear dead silence from anyone you ask
Yeah.
because it has no process whatsoever in the no point whatsoever in the healing process. Making tissue
Mm-hmm.
cold slows things down. So you're asking the wrong question when you say, "Well, I'm going to help it heal." No, let's stop. That's not what you're trying to do. What you're actually trying
Yeah.
to do is to prevent further loss and regenerate that which has been destroyed. That's what you're actually trying to do.
Mm-hmm.
So once you get the proper question up top, what are you trying to do?
Right.
Trying to prevent further loss and regenerate that which has been destroyed. Okay, so now let's
Mm-hmm.
just look and say, so what are the things that cause further damage? Like, how does that happen? Well, what would happen in number one would be the congestion will suffocate and kill otherwise perfectly healthy cells that were not involved in the initial trauma. So that's basically the swelling. And so you say,
Mm-hmm.
well, but how do you get rid of the swelling? Should I prevent it from getting there? No, actually, you shouldn't prevent it from getting there, and there isn't a way to prevent it from getting there because your immune system has actually dilated the healthy surrounding vessels and increased perfusion to the area. So that's right out of the textbooks. That's very difficult to dispute that point. And you say, so if I make it cold, won't that slow it down? Well, just hold on. Are you sure you want to slow down the delivery of the repair and cleanup crew to the damaged site? Now you got to think that through. Are you
Mm-hmm.
sure you want to do that? And by the way, when the
Yeah.
tissue rewarms, the inflammatory response resumes, and that fluid's going to come. So you didn't really
Right.
stop it from getting it by making it cold. And
Mm-hmm.
so since you didn't stop it, when the tissue rewarms, the inflammatory response resumes, now the fluid comes. You go, well, so how do I get rid of the swelling? Now we've got the big important question. How do you get rid of the swelling?
Right.
Well, will abracadabra work? No. Will it evaporate? No. There's only one way out, and that's by the passive lymphatic system. Again, right out of the clinical
Right.
textbook. I'm not making that up. I didn't
Sure.
figure it
Passive.
out.
Keyword passive.
That's what happens. Keyword passive. So here you've got the
Mm-hmm.
passive lymphatic system. The only exit route for this congestion that is forming in and around the damaged site that is causing the additional damage that you're trying to prevent. So, reasonable question.
Mm-hmm.
How do you move waste to a passive lymphatic system? By sitting still with a bag of ice wrapped tightly around it with the body part stuck in the air? Now you
Mm-hmm.
show me give me anything that says that's how it moves. And then I'll stop saying that's
Yeah.
not how it moves. And the fact is, over
Yeah.
the thousands and thousands of professionals that I've spoken to, not a single person has ever said that sitting still with a bag of ice wrapped tightly around an area with that body part stuck in the air is how waste moves through a passive
Mm-hmm.
lymphatic system. It's simply not how it works.
Right.
You've got to activate the
Mm-hmm.
muscles in and around the damaged site. In effect, it milks the cow
Right.
backwards. You get the visual? So
Mm-hmm.
it milks the cow backwards.
Yeah.
Because the lymphatic system is passive,
Mm-hmm.
it's a one-way system. You have got to activate the muscles in and around the damaged site to move the waste. Now, when you grew up, our coaches told us to walk it off. They said, don't sit still, it'll tighten up. Everyone knew that. And by the way, since the beginning of time,
Yeah.
everyone knew that. It
Mm-hmm.
was just back in 78 when Merkin made up the R.I.C.E protocol that
Exactly.
everything started to sit still. Now, so here we've got this problem. We've got
Mm-hmm.
congestion that's going to suffocate and kill otherwise perfectly healthy cells that were not involved in the initial trauma. And we've got this congestion that won't move
Mm-hmm.
on its own, so we need to move it. So obviously, you've got to
Right.
activate the muscles in and around the damaged site to move the waste. So that's the big step.
Mm-hmm.
How do I prevent further loss? You've got to decongest the area. Okay, well, how do you do
Yeah.
that? By activating the muscles, by loading the tissue. Oh, okay. So,
Mm-hmm.
I get it. I'm going to milk the cow backwards. Correct. Now, what's the
Yeah.
next way
Yeah.
that there's loss? Well, the next way would be disuse atrophy. And
Mm-hmm.
disuse atrophy is the result of disuse. Get that? Isn't that amazing? If you
Yeah.
don't use it,
Yeah.
it will go away. Or as the saying says, if you don't use
Mm-hmm.
it, you'll lose it. Okay. So
Yep.
what prevents the loss? Using it. And how does that work? Well, when you activate the muscles, when you load the tissue, the muscles produce and release PGC alpha 1 that blocks and retards the disuse atrophy. It's just that simple. And so you
Mm-hmm.
say, well, now wait a minute.
Yeah.
You mean to tell me the two big things that go wrong, I suffocate and kill otherwise perfectly healthy cells who are not involved in the initial trauma by decongesting the area. So I get rid of that problem. And then if I use the muscle,
Mm-hmm.
it won't atrophy. So the two big
Right.
problems that are basically the fundamental issue in the rehab process are basically eliminated by simply activating the tissue or loading the tissue.
Yep.
Now, the next thing that goes wrong is faulty scarring. Now, clearly, the literature
Mm-hmm.
has no sympathy whatsoever for this. If you put ice on damaged tissue, you're going to cause faulty scarring. So that's just
Yeah. Yeah.
simply wrong. Now, with that though,
Mm-hmm.
if you don't reorganize the repaired tissue, if you don't reorganize it, what's going to happen is you're going
Mm-hmm.
to have faulty scarring, which often leads to adhesions,
Right.
which would lead
Mm-hmm.
to loss of function, which is another loss. So
Right.
your three big losses:
Right.
suffocate and kill otherwise perfect healthy cells that were not involved in initial trauma. That's the congestion. And then you have the disuse atrophy. And then you have the faulty scarring. So those are the three big losses. I just took those away. They're gone. They're not
Mm-hmm.
there anymore. And it's like, oh. So
Right.
that's why people who follow your advice, my advice, not my advice, I'm telling what the literature says is so. But if you call it my advice,
Right.
it's not mine. I'm a reporter. I'm a teacher. I'm not a scientist. But if you follow the advice of the
Right.
literature, you can take things that take 6 weeks if you do it wrong
Mm-hmm.
and easily
Mm-hmm.
reduce it to 2. We do it all the time. I have hundreds of case examples.
Yeah, that's a perfect example because for years I always prescribe ice for my patients. With like you say, various types of injuries, chronic, acute, muscle strains, sprained joints, and when I stopped recommending that and followed the protocol or the path of encouraging movement of fluid and helping to, even accentuate through different modalities like class 4 laser therapy to open up the microcapillaries to bring new oxygenated blood to the tissues, the recovery time literally in half on average, depending on what the injury was. And it was, and when you're used to, treating people for almost 30 years, and then all of a sudden, your patient's recovery and their improvement happens like it with half the amount of time. It's really astounding and very, very obvious. So I completely agree with that assessment that the recovery time is much, much shorter.
It's shorter because you're not causing additional damage. So we've got.
Right, and you're not slowing the process
You're
down.
not slowing it down, and you're not causing additional damage. So those
Right,
two
right.
things are huge points.
Thank you for tuning in to this episode of Inside the Training Room. Make sure to join us in the next part where the anti-Iceman, Gary Reinl, reveals the details of how icing injuries delays the healing and repair and how implementing movement and avoiding the R.I.C.E protocol will speed recovery.